to talk about labor, how it progresses, what it looks like, how it feels, the changes your body goes through. Kind of divided up into pre-labor and early labor signs. So some pre-labor signs are that your blood volume increases, so you may notice some swelling in your hands and feet towards the end of pregnancy. Lightening occurs when baby's head engages in the pelvis. You may notice that there's less pressure on your diaphragm, so you're able to take a deeper breath, or maybe your pants fit a little differently. Another pre-labor sign is the nesting instinct. We don't always think of that as something real and tangible, but it is. It's a physiological thing that happens in women who are preparing for birth. We get a surge of energy and a strong desire to prepare ourselves and our homes for baby. So I don't want you to use that surge of energy late in your pregnancy to tackle some big home renovation project or anything like that. I want you to conserve that energy for the real strenuous physicalness of labor and birth. But what you can do is start preparing your home. Wash all of your baby's linens and bedding and clothing. You want to make sure that your car seat is installed. You want to make sure that you have a pediatrician that you're going to contract with after baby is born. You have to have a pediatrician on record before you're discharged from the hospital. The other thing you want to do with that surge of energy is make sure your bag is packed for the hospital. You can plan to be in the hospital for a vaginal delivery for about 48 hours, so you want to pack enough loose and comfortable clothing for both you and your partner in your labor bag. If you're planning to breastfeed, you want to make sure that you bring a nursing bra, maybe a nursing nightgown, and definitely a nursing support pillow to help you with positioning as you're learning to breastfeed. I always encourage labor partners to pack some good snacks for energy during labor. Most hospitals don't allow moms to eat once they're admitted to the hospital, but labor partners also need to keep up their energy and their blood sugar. So packing things like beef jerky or granola or something with high protein and maybe an electrolyte drink is good to help you keep your energy for what could be a long labor experience. You do not need to pack things like diapers or wipes. Everything that you need for baby will be provided in your hospital room for you. During your pregnancy, your uterine muscles are going to start contracting. We call those contractions Braxton Hicks contractions. Sometimes they're referred to as false labor contractions. I don't like to think of them that way because it implies that they're not really happening or they're not real, but they are. They're just not progressing into active labor and delivery. Braxton Hicks contractions are like warm-up muscle contractions for your uterine muscles as they prepare for labor. Most women describe Braxton Hicks contractions as being mild and fairly painless, more of just a general tightening right in the front of the abdomen. You may be having these contractions now as early as 32 weeks. If you have 4 or more contractions in 1 hour before the 37th week of pregnancy, you will always want to let your healthcare provider know, as that could be a sign of pre-labor. But Braxton Hicks contractions are normal. They differ from true labor contractions in that they do not form a consistent pattern. They're more sporadic. They can even be changed or completely stopped by changing your activity level, emptying your bladder, drinking a full glass of water. So if you notice that you're having contractions and you want to know, are they Braxton Hicks or are they true labor contractions, start timing them. Do they come at a consistent pattern and interval? Do they change in length or frequency if I change my activity level or drink a glass of water? If not, it's time to start timing your contractions and seeing if they're forming that consistent pattern we look for with true labor contractions. Your cervix is closed during pregnancy. It's closed tight. It's also filled with a clear to yellow jelly-like substance, which is referred to as the mucus plug, which is another layer of protection from bacteria from the vaginal canal in the outside world. As your cervix starts to dilate, which can happen when labor starts, or it can happen a couple of weeks before labor starts. But as that cervix starts to dilate, that mucus plug can pull away in tiny fragments, which you might not even notice, or in one piece, which you would definitely notice. If you lose your mucus plug, it's not a definite sign that labor is about to start immediately, but it is definitely a sign that your body is preparing for labor. The mucus plug, again, should be clear to yellowish, jelly-like substance. It is sometimes streaked with blood as it breaks capillaries as it pulls away, but it should never be accompanied by any significant amount of bright red bleeding. Any significant amount of bright red bleeding in your pregnancy or during your labor should be reported to your healthcare provider immediately. Losing the mucus plug can be a pre-labor sign or an early labor sign. You can lose your mucus plug 2 to 3 weeks before labor starts, or you can lose it as the first sign of labor.
I've heard that it can regenerate even if you lost a portion of it. Is that true?
I wouldn't use the word regenerate, but it can come out in pieces. So you may not lose the whole mucus plug at once. There may still be more mucus plug in the cervix that will come out as dilation progresses.
Okay. And is losing your mucus plug the same thing as what they call the bloody show?
Yes. So typically they refer to bloody show in association with true active labor. When your labor has established a pattern, there will still be some mucus and some bloody mucus that occurs as your cervix continues to dilate. So yes, those words are kind of used interchangeably.
Okay.
Many women are concerned about their water breaking as the first sign of labor, possibly in a public or very dramatic way. In reality, only 10% of women have their water break as the first sign of labor. Far more often, that bag of waters ruptures more in active labor towards delivery. It is important to know that if your water does break, it can happen in 2 ways. If you look at this graphic here, and picture your bag of waters as a water balloon, you could get a hole or a tear in that bag of waters up high and would only experience a small but consistent leak of fluid because baby's head is acting as a plug. Or you can get a hole or tear low in that bag of waters below baby's head, and then you would have the big gush of fluid. All of the fluid that's below baby's head would be released at once. If your water does break as the first sign of labor, you do want to call your healthcare provider and let them know. They're going to ask you a series of questions about your water and when it broke. There's an acronym for that. It's TACO, but you don't have to remember that. Your healthcare provider will guide you through the questions, but they're going to want to know what time did your water break? How much water, the amount of your water. So they're trying to determine, did you have a high leak or a low leak? How much fluid is left in the uterus for baby? They want to know the color of the fluid. Amniotic fluid is typically clear and odorless. And so if it's not, they want to know that. So the acronym TACO, T is for the time the water broke, A is for the amount of water that was lost, C is for the color, and O is the odor. Was there an odor present in the amniotic fluid? True labor contractions, most moms will describe as a feeling that starts in the lower back and wraps around the abdomen. So more of a full abdominal experience. And true labor contractions will always form a pattern. True labor contractions will always get longer, stronger, and closer together as your labor progresses, okay? So labor is divided up into 3 phases: early labor, active labor, and transition. Early labor, the goal is to labor at home. Your labor is just starting. The goal of early labor is to dilate from 0 centimeters to 6 centimeters. You're laboring at home. You can use the positions that you want to. Remember that upright, active positions always help your labor progress, form a pattern, help use gravity to bring baby down into the pelvis. You can eat and drink what you want. Labor partners want to make sure in early labor that mom is staying hydrated and comfortable, maybe using some of the comfort techniques that we talked about earlier with position changing or massage, breathing techniques, and that kind of thing. In early labor, when labor starts, your contractions will only be about 30 seconds long, and they'll be about 20 to 25 minutes apart. You're looking to see, are those contractions forming a pattern? Are they coming consistently every 20 minutes? If they are, they're probably true labor contractions and not Braxton Hicks contractions. Once you notice that your contractions are forming a pattern, labor partners, you need to start timing those contractions to track their pattern and their consistency. You can use an app that's meant specifically for timing contractions, or you can use a regular clock or timer on your cell phone. To time a contraction, you want to time the length of the contraction, and that's from the start of the contraction to the end of the contraction. In early labor, again, that's going to be about 30 to 45 seconds long. You want to time how far apart the contractions are. That's from the start of one contraction to the start of the next contraction, okay? As your labor progresses, your contractions are going to get longer in length and closer together in between contractions. Most healthcare providers will want you to transfer to the hospital when your contractions are 5 minutes apart. Each contraction is lasting 1 minute in length, and that's been going on for a full hour. We refer to this as the 5-1-1 rule. If you transfer to the hospital when your contractions are 5 minutes apart, that should put you in the active phase of the first stage of labor. The goal of the active stage of labor is to dilate from 6 centimeters to 8 centimeters. The active stage of labor is definitely more intense than the early phase of labor. This is when it's recommended, if you're considering an epidural, that you wait until this phase when you're between 6 and 8 centimeters dilated to get your epidural. If you choose not to have an epidural, labor partners will want to be very supportive, encouraging with your words, helpful with helping mom into other positions that may bring her comfort. If she's allowed ice chips, providing those, using counter pressure on the lower back, and just being there for whatever mom needs during that phase of labor. These are some positions that you can use in early, active, or transition labor. You can use these at home or you can use these at the hospital. We've talked about the use of a birthing ball. I like how this mom is using the chair to stabilize her so she's not having to rely on her own sense of balance while she's on that birth ball. Forward leaning positions, again, remember if you're having lower back pain, if you are in a forward leaning position or on hands and knees, you're taking the pressure of baby's head off of your lower spine. So that can be a position that really provides some comfort. Using a chair, sitting upright on a couch or a bed, all allow you to use gravity to your advantage to bring baby down into the birth canal. Another thing that could be helpful during your labor is a birthing stool or upright chair like this one. Sitting on one of these during labor or the early pushing stage can help take some pressure off of your tailbone and your perineum as well. This is a nice upright position to labor in. It allows gravity to really bring baby down into your pelvis in the birth canal. Would anybody like to give it a try?
I will.
All right, great.
Sit like this.
So how does that feel?
Feels comfortable.
You feel nice and supported, and
Yeah, feels like I could labor a little bit on here.
it's a good option. It's good to have several options throughout your labor journey. Lots of hospitals will have these available for you to use. The peanut ball, the birth ball, birthing stools, and upright chairs like this one are oftentimes available. So just speak to your healthcare provider when you get to the hospital. So the transition phase of labor is the shortest but most intense phase of labor. In transition, contractions are 60 to 90 seconds long, and they're coming at an interval of every 2 to 4 minutes. So there's not a lot of rest time in between contractions. If you look here, you can tell the intensity of a transition contraction. There's no gradual buildup and gradual recession. That contraction is intense from the get-go. So many moms will be completely inward focused during transition. They may even close their eyes. Definitely, they are not doing a lot of communicating during that time. Labor partners should use yes or no questions when trying to provide comfort and care to those moms, because they are just going to be completely focused on the changes that are happening within their body. Many women will feel nauseous during transition just because it's such an intense time of labor. But again, it is the shortest phase of labor, and it happens right before the next phase of labor, which is pushing and delivery of your baby.